Welcome back to Woman Made Well. Today, I wanted to talk about what I used to spend all my time doing prior to my podcasting era, and that was being a regular obstetrician gynecologist. And as an obstetrician gynecologist, you clearly are taking care of women. But one of the main focuses of my career up until the last year was obstetrics, and that is providing care for women during their pregnancies. And during my training, I was trained how to take care of women during their pregnancy for all the normal things, the normal physiological changes, and all the things that they would experience. And we can talk about a lot of those things for days. I was also trained more specifically to take care of all the complications that can occur during pregnancy, to look and find for problems with the moms and problems with the baby so that we could have the best outcome. What's interesting about this is that in all my training to take care of all these different complications and all these different events that happen during a pregnancy, I did not spend really any time learning how to care for or diagnose postpartum depression or postpartum anxiety. Why is this interesting? It's interesting because postpartum depression and anxiety happen in 10 to 20% of women. Most of the complications like diabetes and preeclampsia that I spent a lot of time learning how to take care of and continually learning how to better take care of patients only happen less than 5% of the time. This was really, really interesting to me. And this percentage, the 10 to 20%, doesn't even include all the other women who maybe don't meet the diagnostic criteria for postpartum depression, but they are definitely not transitioning well into motherhood. So, as I recognized this in my career, as I've talked about before, I really started to struggle with it. Then, my other career is a mom. And as a mom, once I had my children, I had the desire, the intense desire to be the best mother that I could be. I had this unconditional love for my children that I never understood until I had them. And I definitely was grateful and recognized the joy that the opportunity to be a mother brought to me. But I also, equal and opposite, and at some moments worse, I felt trapped. I felt unsurmountable pressure to be perfect at everything. Since this was my career, delivering babies, I think I almost felt even more that should be better at being a mom too, so that I could be an example to my patients. And it was overwhelming. And it was such an interesting dichotomy to be on both sides of the spectrum. On the scientific side, where I was supposed to be the provider caring for these women, and I was supposed to be diagnosing this and offering treatment, but but then as a mom, to experience it, to experience shadows of it, to experience what it was like to be a mom and feel all those feelings of change and imperfections and not being able to keep up with what I expected of myself. And it really, like I've talked before, changed me in my career and changed my thoughts about motherhood and about, everything that I'd done to that point. And so today I wanted to talk about, the actual diagnosis of postpartum depression, and not necessarily the diagnosis, but what are the risk factors for it and why does it happen? And I think when we talk about why postpartum depression or anxiety are so prevalent and why they happen, that the most important place to start is with the risk factors that in the scientific community that we have found to lead to them. And as a physician, that I would be looking for in order to help my patients and potentially prevent them. There are lots of risk factors for postpartum depression, anxiety, and a lot of them are the ones that you would expect. We kind of break down the risk factors for postpartum depression, anxiety into three categories: biological, psychosocial, and environmental. And as far as the biological ones, these ones are pretty as expected. A personal history of depression or anxiety, it puts you at more risk. And that's not a surprise. That could actually put you at 2 times the risk of another person to get depression or anxiety during the pregnancy, even before postpartum. A family history, even if you don't have one. So if somebody in your family has a history of depression or anxiety, that also puts you at an increased risk. If you are not in good physical health, maybe you have diabetes or obesity, that also is an increased risk. Any immune disorders or hormonal imbalances can put you out of risk as well. Another interesting one that is important to think about before you have your baby is insomnia or sleep disturbances. And now all of you guys who've been pregnant have like bells ringing off, fire alarms saying nobody sleeps in the third trimester, Dr. Wood. And so are all of us at risk? And I would say, of course, that's not a good setup. But I think what this is meaning is if you don't sleep well in general, even when you weren't pregnant and throughout the whole pregnancy, you have poor sleeping patterns, sleeping routines, and you don't sleep well. And then another obvious biological is any substance use disorder. Any mothers who are dependent on substances always have an increased risk for postpartum depression or anxiety. As far as the environmental risk factors, what are these? Adverse childhood experiences definitely set you up to have triggers or bad responses postpartum, and I've definitely seen this. Intimate partner violence is huge. Women who are being abused during pregnancy, physically and especially sexually, are at increased risk for postpartum depression and anxiety. Any abuse history, difficulty with cultural expectations about motherhood and about how you're going to carry the baby, deliver the baby, and what you're going to do after. Any pregnancy loss, if you've had a history of miscarriage or a term loss or any other loss or poor outcome, is definitely a risk factor. And this is a major one that I see. This also, as I insinuated, includes obstetric trauma too. So, negative delivery or difficult delivery in a prior pregnancy. A baby in the NICU or a baby with genetic abnormality that's having difficulties is always an increased risk for postpartum depression. And I think that's pretty obvious for everybody. And I think we'll also talk about that a lot in other podcasts. Difficulty breastfeeding. That's a huge one. I'm super excited to talk about breastfeeding. Lots of information and opinions and experiences with that, but that's definitely a setup. And any obstetric or medical complication that you've had too. So, moms who have post op issues or readmits are also a setup for postpartum depression. And then for psychosocial, any race that experiences any sort of racism or inequity in healthcare is at risk for postpartum depression. Age, either young, under 20, or greater than 40, are at bigger increased risk. Veterans are at increased risk, and active duty military members as well. Women with low socioeconomic status, lower education level, and women without proper support, relationship issues, not being with the partner, unplanned pregnancy, self-esteem issues, and women who at baseline ruminate a lot, which means that you think about things a lot and cannot move past things that you're struggling with. That was a lot of information about risk factors. If interested, please send me a message and I can give you a copy of that. That's actually just released from the American College of OBGYNs just this year. And it's a pretty concrete list, and I would be happy to get that out to anybody who's interested. I was always interested as a doctor in risk factors and scientific information about everything that I treat. And so I always took these lists and used them. But as I got into actual practice, I definitely still used them. But as I increased my years in the field and also as a mom myself, I definitely started noticing patterns that I saw myself and different reasons that I would have more expectation for patients of mine to struggle with postpartum depression. And they definitely included a lot of these. But I also felt that as I got to know patients better and could apply these to actually what I knew was going to happen postpartum, that I came up with a much shorter list that is easier for me to explain to patients about things that they should watch for and things that set them up. And also, as a mom, my list is more focusing not just on the diagnosable depression and anxiety, but also on the difficult transition to motherhood. Why is it so hard? And what sets us up for that? And that's what we're going to spend the rest of this podcast talking about, because I think this is really what's crucial. We can all look at the list of risk factors provided by ACOG and apply that to ourselves. But I think it's more interesting to think about the challenges that we face postpartum and how those things affect us and how they can lead for us to not be functioning as well as we'd like. And so, what am I talking about? Let's dive in. The first one that comes to mind and is so obvious to most of us, and I think we wish we could blame everything. I wish I could blame everything in my life on it. I try not to, though, but that's hormones. The hormones in pregnancy are really pretty fascinating. As a woman, and all of you guys who have had any sort of class in sex ed in fifth or sixth grade, you have seen the picture of the menstrual cycle. And you see that throughout the month, there are hormones that are bouncing up and down. And that is what creates ovulation, which allows you to have the potential to get pregnant. And also there's other hormones that support the lining so that if you do get pregnant, that there is a place for the baby to survive and grow and live. And those hormones, the big players are estrogen and progesterone, with a side player of LH. We're going to focus on the progesterone and estrogen. In the menstrual cycle, progesterone ranges from 20 to 25 nanograms per milliliter, and estrogen can range from the low 20s up to 400 picograms per milliliter. And that's normal in the menstrual cycle. So those are the values of those hormones that you're seeing every month. In pregnancy, those drastically increase, and they continue to increase throughout the pregnancy and reach their peak at the end of the pregnancy. So it's kind of crazy when you think about it. So again, your peak during a normal menstrual cycle of progesterone is about 10, maybe 15. And at the end of pregnancy, it can be up to 300. Okay. Then estrogen, which typically gets into the low hundreds during the menstrual cycle, at the end of a pregnancy can be in the thousands. So you're at this level of hormone that you've never seen before in your life. And then, as you guys all know, what happens? You deliver the baby, the placenta is removed, which is a big contributor of these hormones. And over 48 hours, those levels plummet to baseline levels. And it is no wonder that everybody doesn't, it's a wonder to me that everybody doesn't lose their mind postpartum with such an abrupt change. But for me, when I think about postpartum blues, which we've talked about, which affect 50 to 70% of people, it's no wonder that happens. Everybody deals with hormones differently, and that's why there are people who have premenstrual dysphoric disorder and PMS. But this extreme drop definitely affects almost everybody, and it's just in different ways. And we've talked about that a little bit before. But this can go on to still have prolonged effects. And this is one big contributor into why women struggle postpartum, because that's a huge change. And then we add breastfeeding if that's a choice that you've made. And then we have two other hormones that are going up and down, literally like a roller coaster, and that's prolactin and oxytocin. And we will probably do a whole episode just on breastfeeding and the hormones that affect it, and women who have had the Demer reaction, where you have extreme depression every time you breastfeed. They will know what I'm talking about, and they will admit that they not admit, but they will know that hormones play a big part in their mood postpartum and their ability to transition into motherhood well. And like I said, this affects everybody differently. There's going to be people who won't say that they felt any hormonal imbalance or even struggled necessarily with postpartum blues. But that is definitely a big player in the setup for this, as the environment of your brain is completely different with that drop of those hormones. The next thing that I think is super important to talk about is the task load that you're taking on as a new mom. And what's different about this task load when I think it's such an interesting thing to think about, because when you don't know, you don't know. And then as we sit here, if this audience is all mothers or someone who's cared for a newborn 24 hours a day, 7 days a week, you know what I'm talking about, that until you've done it, you had no idea what it was. And the interesting thing about the task load is it's also a task load that you probably have care more about than you've ever cared about. How well you do it, how effective you do it, and what the outcome is. And so you're taking on this new task, and it never stops. There's no breaks. There's no Fridays. There's no Saturdays or Sundays. It's the same thing every day, every hour. And you want so badly to be perfect at it. What is the task load? It's feeding the baby. It's changing the diapers. It's soothing your baby. It's making sure that you're giving the baby enough tummy time. It's that you're giving the baby exposure to things. It's making sure that the baby's sleeping enough so that their brain can develop well. And these are just the obvious tasks. If anybody's read or been exposed to the book Decreasing the Mother Load, you know the other list of tasks that is also the burden that you are bearing right now. And those are the unseen tasks, the household tasks that are obvious, cleaning the house, cooking, but then there's the unseen load, the getting of the cleaning supplies, the clothes that the baby needs, changing out the clothes when the baby is grown out of them, the appointments to the doctor, family events, family birthdays, all the planning that's involved in taking care of a household that you are doing at the same time as you're trying to transition into this new role of caring for a baby. And again, what makes these new tasks, caring for your child, so different, and caring for that household you're in charge of with your new baby so different than anything else, is how much you care about it. And even if you are one of the mothers who struggles bonding with your child, typically you still care about completing the tasks. And this is a very difficult burden. And in light of all of it, you don't feel good at it because it's all so new. And these are all topics that we'll dive even deeper into later dates. So again, postpartum, we have huge hormone changes. And then we've become a mom, and it's something we've always wanted and we want to do well at. And so we're meeting this new incredible task load that has no end date, and we value it. And so it's heavy. The next thing is the expectations that we place on ourselves. And this kind of goes hand in hand with the last one. But talking about some of those risk factors, cultural risk factors, expectations that you or your family has, maybe your spouse has. You expect yourself to love it, but wait, what if you don't? You expected it to come natural, but what if it isn't? You expected yourself to know all the answers. And this happens especially with my moms who are NICU nurses. They expected themselves to be so natural as mothers, but when you're home with a baby and there's no heart rate monitor and there's no way to be sure everything's okay, it's a totally different story than the babies that you take care of at work. Then you realize you expect yourself also to still be on top of everything you were doing before. You should still be able to keep up with your social calendar, your hair and your makeup, and your job, and you should still be able to do just as good at it. The expectations that we have for ourselves and our ability to keep up with them are a huge contributor with our ability to successfully transition into motherhood. The next thing is support. I think this is one of the most difficult things for me because as a provider, I can't necessarily control the amount of support a patient has. And we can't use cognitive behavioral therapy to magically make extra support appear. So it's very difficult. And I take care of moms from multiple socioeconomic classes, and also moms with every single imaginable situation, moms who are choosing to parent completely by themselves and have no family in town, parents who have potentially too much family in town, and that's the issue. Parents where it's just friends, parents where it's just a sister, and it's all different. And that having support versus having no support sets up your ability to make this transition and to make it smoothly without developing any mental health issues, very difficult or very easy. And when I work with patients, I especially like to talk about this, even though I don't feel like I can solve the problems. I like to talk about it because knowing what we have before the baby comes and making strategic plans can eliminate some of the problems that we can see, so we can figure out how to use what we have and how to strategize if we don't have. And so the support that we get can be extremely important to help the situation and also important to make plans so that it doesn't cause problems as you transition into motherhood. Another big one that is not necessarily thought about much, but I see it, I felt it, and I think it's so crucial, is that the, in transitioning to your new role as mother, there's this huge mourning for your prior self. And some people may feel like that's a selfish thing to do or a silly thing, but almost everybody does it. And I think it's actually extremely healthy. Uh, if you have something to mourn, I always feel like that's something to celebrate because it means you had something good. And if you don't mourn your prior self because this is something you've worked towards and you've worked and you've prepared and you've made the necessary changes in your life to be prepared for it, that's also fantastic. But a lot of my moms really struggle, and I was one of these who after having a baby, I was so happy, but I also felt trapped. And I had no time for myself. And I didn't really want a ton of it. I didn't need to go to spa days. I didn't need to see my friends every day, but I felt like I had no time for myself. There was always something to do. And I had the thought multiple times, and I tell patients this all the time, that I think you're actually super normal if you have this thought, that what did I just do? Why did I even choose to have a baby? I had a really good life before. And can you imagine, a lot of us, luckily, this is a choice to have a baby. And so when we have this question, we know, well, we chose this. But there's a lot of moms who these were unintended pregnancies, and they're having that same emotion where they're wondering, what did they do with their life? And are they ever going to find happiness again? And this is important to actually be honest about. Don't be ashamed. Find somebody you trust to talk about this. And because it's something that is valid. And I think when you are able to appropriately mourn for yourself, that is when you can actually figure out who you want to be as a mom. And it's a huge key to the pathway to finding happiness in motherhood. Now, the coup de grace, and I think the biggest one, and it's the one that is the hardest to fix right away, but it is also the one where I think if we have support and planning, we can do something about it, and that is the lack of sleep. So sleep is essential. It's essential to your mental health, your physical health. Your brain needs it. Your brain needs time to process what happened during the day, create new pathways so you remember things, so you remember tasks you're learning, so you remember things that you want to remember, memories, and so that it can clean out toxins that the brain collects during the day. It is study proven that people who sleep have better moods. They have less stress. They get along with people better. They are physically healthier. Their metabolism is higher, so they are usually healthier weights. They have decreased risk for diabetes and also heart disease. It is also study proven that women, not just women, all humans that do not sleep well are at higher risk for depression and anxiety. And so you can imagine that when you're postpartum, struggling with hormonal adjustments, struggling with a task load that is insurmountable and that you care tremendously about, with new expectations you're not meeting, maybe some support not enough, and then adjusting to losing the person you were before, that how crucial it is to have sleep for your brain to process all that and to move through this experience. And so this is one when I see it's a question I ask every mother how they're sleeping, and nobody's sleeping well. And everybody who's listening can say, well, Dr. Wood, what do you mean? I have to feed a baby every 2.5 to 3 hours. How could I be sleeping well? But I have moms who can't even sleep during any break that their child is giving them. And it's due to anxiety, ruminating thoughts, worry about their child, or not being able to shut things down because they know that the task list is never ending. And this is crucial. And so I ask every patient, if somebody's with your child that you trust, can you sleep? And if they can't sleep during that, that is somebody I worry about a ton. And we make a specific plan and I follow up with them quickly. When we don't sleep, when we're awake for 18 hours straight, our blood alcohol level is 0.05. And so we are at risk for just accidents. It's dangerous, not only to our mental health, but also to our physical health. And so this is key. And so in there are many other things that we could talk about, obviously, and these are just the top items that I think about when I think about the transition to motherhood that are huge game changers and are huge contributors to why my moms struggle in this transition. And they're also huge spots when we can talk about it beforehand and immediately after, that we have a lot of room to improve and fix things so that I can keep my mothers from potentially having a diagnosable mental health condition or just help them recover. And again, their hormonal changes, the task load, your expectations, support or lack thereof, mourning your prior self, and the lack of sleep. I am a huge believer in preventative care. And, my whole goal in starting this podcast is to get the information out so women can start making changes and getting help when they need it. And my whole goal is that I can be able to get women while they're pregnant so we can talk about all these things and help them before. But if you're already postpartum and you're experiencing any sort of symptoms, and you recognize the contribution to any of these factors to you, it's time to start digging in on how we can fix them. And that's what we'll be talking about in upcoming podcasts. But if you're having any big issues, as I would always encourage, call your provider or call the crisis line that we'll make sure to have on the end of all of our podcasts, so everybody has that has somebody to reach out to. I As always, I am so happy to be here, encouraging every mother to be the best mom that they can, and helping them recognize the worth of who they are and the life that they're changing every day, that they're trying to do the best that they can at their job. In summary, today we talked about the risk factors for developing postpartum depression and anxiety that the American College of OBGYNs just released. And then we talked about some of the contributing factors that in my 18 years of practice that I've found and feel are the biggest contributors to why women struggle with this transition. And those include the huge hormone changes, the adjustment to the task load as a mother in something that you care so much about and value. Next, adjusting to your expectations and doing all this with maybe not the support that you ideally would have, mourning your prior self, and then the coup de grace, doing all of this with insufficient sleep. And as you guys think about this in your life, and if you're pregnant, I hope you stay tuned so we can start diving into these topics and help you prepare so that you're ready for this postpartum. And if you already have your baby and you feel like any of these resonate with you, I also hope you stay tuned because we'll be talking about all these topics as we move through the Woman Made Well podcast. Our goal is, as always, to help every mother reach her potential and love motherhood. And by doing so, I hope that I can help you find joy in your life and joy in your children. And anybody who's really struggling with anything we talked about, please call your provider. And we'll also include the crisis line in the podcast information so you always have somewhere to call. We'll talk to you soon, and you guys have a great day.